Hello everyone, this is Dr. Biniyam, obstetrician gynecologist, senior fistula surgeon and urogynecologist, medical director of Hamlin, Fistula, Ethiopia. Today we are going to talk about perineal tears. Perineal tears are separation of the muscles or the sphincter or connective tissue which align between the posterior vaginal fourchette and the anal opening. When the sphincters are involved in this separation, we call it third-degree perineal tear. When the rectum is being involved, we call it fourth-degree perineal tear. When the sphincters are not fully torn but separated and making the woman to be symptomatic, we call it lax perineum. When this problem happens, a woman not able to be continent with bowel movement. So she may leak gas, liquid or solid stool. And sometimes there could be a chance of having soiling into the vagina. That makes her uncomfortable in daily routine activities and it affects her sexual function as well. So it is just like an obstetric fistula, makes the woman having something that affects her quality of life. This condition happens most of the time during labor and delivery process when the baby is big and not able to negotiate with the birth canal in second stage of labor. And professionals whom attended this labor and delivery process not supporting very well or ahead of time during episiotomy, most of the time, if the woman delivered at home, there is a chance of having this problem. As we know, in Ethiopia, around 50% of mothers are still giving birth at home. So the risk of having this problem is very high. When mothers are coming to us with a complaint of this condition, leaking solid air or liquid, we make them having detailed history and taking the questions how much it affects the quality of that woman and using Wexner score to know the exact problem that she's having and doing the physical examination to confirm a specific diagnosis that makes the woman to have such a kind of complaint. Once we make a diagnosis, then there is a chance of having surgical intervention. One which is recommended by most of the professionals is overlapping sphincteroplasty. So once we did the overlapping sphincteroplasty, we make the woman to have a follow-up, and during this follow-up, we use the Wexner score to compare the outcome that we have after the surgery. So perineal tears are one of the pelvic floor injuries. So the most important thing that we need to do is preventing them. So the prevention, it is being done by the midwives whom attended the labor and delivery process. Any professionals need to know how they are going to support, when they are going to make decision for instrumental deliveries, and what are the preconditions and prerequisites that makes the woman not to have such a kind of problem. And the other way around, we need to make sure that the health system, maternal health, need to be improved. So mothers need to understand the benefits that they are going to get from an institutional delivery, having ANC follow-up, and once they are having these kind of problems, they are a place where they are going to get surgical intervention. We want to make sure that residents, medical students, fellows, and international students and professionals coming to Hamlin, Fistula, Ethiopia need to have clearly understood the benefits of overlapping sphincteroplasty.